Parents, when they see their child suffering from an ear infection, typically will see a child who not only just looks ill and doesn't feel well, but also is pulling at their ear, or occasionally will actually have frank drainage coming out of the ear. Your primary care physician, your pediatrician, or your family practitioner should be able to determine whether or not your child has an acute infection and whether that infection needs an antibiotic or simply observation. The average child doesn't need to see us for an ear infection, fortunately. Really what's happening is your physician is determining when it's time for us to take a look at your child. 3 or 4 infections over a short interval of time. Some children don't have any infections and they simply have fluid or an abnormal hearing evaluation. So the visit to the pediatric otolaryngologist for ear infections it's a long process. So we like to warn parents when they come in, they're not just simply visiting with me, they're visiting with the audiologist, they're visiting with us as a team to determine whether or not their child really needs tubes. A set of ventilation tubes is a fairly quick process. Usually the whole process for a family, from the time they arrive to the surgical center to the time they go home, is about an hour. Once you have a set of tubes put in, I like to remind families that that is simply the easiest and the first step to the process of following a child with ear infections.